When you compare the international recommendations versus that of the Lipid Association of India, you have the lipid LAI guidelines on high, very high, and extreme risk with the where you have diabetes with ACCV risk factors, where your LDL cholesterol has to be less than 70, with more than 2 ASCVD risk factors, LDL cholesterol less than 50, category A and category B, where with or without target organ damage, you look at levels of less than 30 and maintain it in the lowest level possible. So looking at the LDL goals in diabetics, you have with or without ASCVD, high risk, very high risk, extreme high risk categories, and LDL in the extreme high risk, less than 50 and less than 30 milligrams percent are the goals of therapies. What about the non-HDL cholesterol in the ApoB levels? You have these depending upon the categorizations, varying from various levels in less than 60 to less than 100 for the non-HDL, and less than 50 to less than 80 for the ApoB values. What are the newer treatment options that are available? What we have today, we have bempedoic acid, we have PCSK9 inhibitors, and we have what's coming next is the gene editing, of which there was a paper recently of a 14-patient study where a single dose of gene editing has resulted in spectacular results. But of course, that is just a small number study that still has to undergo long-term studies. What are the non-statin LDL cholesterol lowering agents? Ezetimibe, bempedoic acid. Then you have the PCSK9 inhibitors, alirocumab, which is not available, evolocumab, which is available, and Inclisiran. Bempedoic acid targets the ATP citrate lyase, which is an enzyme which is upstream from the HMG coenzyme A reductase. It upregulates the LDL cholesterol receptors, lowers the LDL cholesterol. Because the isoenzyme that converts bempedoic acid is not available in muscle, the skeletal muscle side effects are less with bempedoic acid as compared to statins. Trials have shown that bempedoic acid can reduce and does reduce LDL cholesterol over a period of time. It also has shown certain changes in the hsCRP values in addendum to the reduction in the LDL cholesterol values. The clear outcomes bempedoic acid in statin intolerance trial has shown that bempedoic acid can reduce the LDL cholesterol by almost 30 milligrams percent and a 4-point MACE by almost 13%. Coming on to PCSK9 inhibitors, these are the first drug that came into the Indian market was evolocumab, which is a monoclonal antibody. And the way it works is by reducing the PCSK9 levels. And when that happens, there are more LDL receptors available to take on the LDL and reduce the circulating LDL cholesterol values and the uptake of LDL by this tissue. The FOURIER trial was one of the trials which showed that in atherosclerotic cardiovascular disease patients receiving high-intensity statins, it lowered the LDL cholesterol to a median of 30 milligrams percent and significantly reduced cardiovascular events. As the LDL cholesterol value reduces, there's incremental benefits at each level of reduction. And that is seen, but that was also shown in the FOURIER trial. Taking the FOURIER and the FOURIER OLE into the same chart, the FOURIER trial was 2.2. The OLE was an extension to 5 years. The charts continue to diverge even at the end of 5 years, showing that the benefits of using evolocumab in terms of LDL reduction and in terms of the primary endpoints is an extended phenomenon. Alirocumab post-ACS was studied in the ODYSSEY outcomes, not available in India, but again, it showed that there was a significant benefit in those patients who were given alirocumab. Inclisiran is another new drug, a new kid on the block as far as the Indian market is concerned. It's a short-chain synthetic siRNA which prevents PCSK9 protein production. It binds to the messenger RNA, which is a precursor of the PCSK9 protein, and then undergoes a degradation. It has a low immunogenicity, high durability, and it is one of the. It is basically these levels. The level of inclisiran per se declines within 24 hours, undetectable in the blood within 48 hours, low likelihood of off-target binding. So it basically mimics the body's process of RNA interference and thereby reduces the PCSK9 levels. The LDL cholesterol, the ORION-1 was a dose-finding study where it showed that even at the dose of 200 milligrams and 300 milligrams, it showed a significant fall in the LDL values, and that too within 14 days after the first injection. And by day 30, the mean reduction is about 50%. There's an effective and sustained reduction of LDL cholesterol versus placebo which is shown in the ORION 10 trials, a 52% effective reduction in the LDL values and a 54% sustained LDL cholesterol reduction in these patients. The ORION 9 in patients with the ASCVD on maximally tolerated statin therapy, again a significant reduction in the LDL cholesterol values as compared to placebo. The ORION 8 basically showed that it had a on an extended term follow-up. The efficacy was still maintained in those patients, followed up for a mean exposure of 3.7 of almost 6.8 years max, almost 12,000 patient years of exposure. So looking at that value on the right-hand side, the efficacy of this is still maintained. And in each of these groups, in atherosclerotic vascular disease and in those with atherosclerotic vascular disease equivalent patients, the reduction was quite significant.